Hi, so today let's talk about gestational diabetes mellitus. Now, the first and foremost thing is what is gestational diabetes mellitus? When your blood sugars are normal before pregnancy, but you develop diabetes in the pregnancy is known as gestational diabetes mellitus. The next question is that how do you know that you have got GDM? So there is a test which is known as oral glucose tolerance test, which is done between 24 to 28 weeks of pregnancy, which helps us to diagnose that you have got gestational diabetes mellitus. This test is done only for high-risk women. Now, who are these high-risk women? The women whose BMI is more than 30 kg per meter square, first. The second is the women who have delivered a large baby in previous pregnancy that is more than equal to 4.5 kilos. The next thing is that the women who had gestational diabetes in their previous pregnancy, or those who have strong family history of diabetes mellitus, specifically in the first degree relatives, which means like father or mother. The next thing is that the women who belongs to areas where the risk of diabetes mellitus is more, like Middle East areas, African women. So these women for sure, and Asian women, that diabetes has to be checked. Now, what can you actually do to prevent developing diabetes during pregnancy? The first and foremost thing is that you have to make sure that you embark onto the pregnancy on a healthy weight. The first thing. The second thing is that you can continue doing your exercises when you are pregnant. Pregnancy is a physiological state. It is not a disease. So you don't need to be sedentary. You can actually be very active and continue the exercises with the advice of your healthcare professional. And the third thing is controlled weight gain. So make sure that you do not gain too much of weight when you become pregnant. So these are the preventive things which can be done to prevent diabetes mellitus during pregnancy. How do we treat it? With the help of diet, exercise, some medications, or sometimes insulin is required. Now, one very important thing which I wanted to emphasize is that once the baby is born, it is very important that you check your blood sugars at 6 weeks. Because depending on the levels of your blood sugars at that moment, we can decide whether you are at high risk of developing diabetes in your later life or not. Lifestyle advice has to continue after 6 weeks of pregnancy, which includes diet, exercise. That's very, very important so that you prevent the risk of diabetes to happen to you. Thank you. Hope that helps.